In this video, we'll discuss an approach to describing fractures on an X-ray. Before we start, always remember with all X-rays you should apply the rule of twos, which states that you should have two joints visible, the one above and below the fracture to exclude articular joint surface involvement. You should have obtained two different doctors' opinions. You should have two views and two sides visible. That is, an X-ray of the normal contrast side for comparison. This approach is divided into 7 steps. So step 1. What is the patient's name, age, date of the X-ray, and consider the rule of twos to make sure you have the right patient and the most recent X-ray. So now we can begin to look at the actual X-ray and describe it. So step 2. Determine the location of the fracture. Name the bone involved. Is it the femur, the humerus, or the ulna, for example? And the part of the bone affected. Does it affect the head, the shaft, or the joint surface? Extra-articular fractures are usually less complicated unless they are comminutive. Step 3. This is an open or closed fracture. If the skin is still intact, it's a closed fracture, and if it's not, it's open. In the image, you can clearly see that this is an open fracture with all the soft tissue exposed to the environment, increasing the risk of infection. Step 4. Determine if the fracture is complete or incomplete, also known as green stick fractures in children. A complete fracture is when the bone segments separate completely, and in an incomplete fracture, they do not. Step 5. Let's look at the pattern of the fracture. The pattern really looks at how the bone has been divided as a result of the fracture. They can be simple, segmental, or comminuted. A simple fracture is further subclassified as transverse, oblique, or spiral. The X-ray shows a simple oblique fracture, and in particular a Galeazzi fracture, which is a fracture of the radius with dislocation of the radial ulnar joint. A segmental fracture is when the bone has been broken in two parts, leaving one segment unattached with no lateral stability. This is a segmental fracture of the ulna. And lastly, a comminuted fracture has multiple fracture lines and many bone fragments, as you can see in this example. There's a comminuted fracture of the tibia and a simple transverse fracture of the fibula. Step 6. In this step, we'll determine whether there has been displacement. This describes how the distal bone has moved relative to the proximal bone. A fracture is displaced if it has moved greater than 50% in the lower limb and greater than 100% in the upper limb. Now we will look at the types of displacements. Shifting means that the distal fragment has moved along the horizontal plane relative to the proximal fragment. This X-ray shows a lateral shift. Shortening refers to when there's a proximal migration of the distal fracture causing a decrease in bone length. However, the bone is no longer aligned. Whilst the opposite of that is dissection, which is when there's an increase in the overall bone length, not seen in this X-ray. Angulation refers to the tilt of the bone. That is whether the most distal portion of the distal segment points laterally or medially, known as valgus or verum, respectively, or anteriorly or dorsally. To appreciate this, different X-ray views are required. Impaction refers to when there's a decrease in bone length but the alignment is preserved. This is not seen in this X-ray. And finally, rotation. The bone may be internally or externally rotated, and this is also not seen in this X-ray. Step 7. Look at whether the joint surface is involved, and if it is, you can look for a gap, a step up, or impaction. These parameters can be measured in millimeters, and if they fall within the acceptable ranges for that joint, reduction may not be necessary. So again, when looking at an X-ray, check that this is the correct X-ray by checking the patient's name, check the date of the X-ray, and make sure to apply the rule of twos. When describing the fracture, state its location, is it open or closed, complete or incomplete, describe its pattern and its displacement, and is the articular surface involved, and if yes, is there a gap, step up, or impaction?